You know, the cost of health care continues to rise, and the last thing you need are unexpected fees after getting medical treatment.
Tonight, Glenda Lewis shows us what to look out for so you don't waste your money. Glenda?
Alan, Carolyn, the last thing you need after a medical procedure or hospital stay is a pile of confusing bills, especially if those bills contain unexpected charges or incorrect fees. These are common and sometimes complicated problems that can take years to resolve.
When Bill Linden's wife, Kate, was rushed into an emergency C-section, he was only thinking about one thing.
It's a life or death situation. Baby has to come out now. Period. End of story.
He was not thinking about the anesthesiologist that was brought in or whether insurance would cover it.
I was not really thinking about paperwork at that point in time.
But soon, paperwork was all he'd think about. Bills started arriving, saying he owed roughly $2,500. Many phone calls later, he found out that it came down to a network classification. The anesthesiologist was considered out of network, even though the hospital was in network. Sounds simple enough to correct, but Linden says it took 14 months to determine they didn't owe the money.
It was a lot. It was a lot.
Penelope Wang of Consumer Reports says this is hardly uncommon.
There's a very good chance that your billing problem will drag on for weeks, months, or even years.
A CR survey recently found 2 out of 3 people who had a major health expense in the past 2 years had an issue with their bill. More than a third say they'd paid bills they weren't even sure they owed.
They felt it was too much trouble or too much effort to fight.
So what can you do to ease the pain? Linden ultimately worked with a nonprofit patient advocacy group, which laid out the steps he should take.
This is the documentation you need to get. This is who you chase down. Send things certified mail.
You can also hire a medical billing advocate for a fee. And if the unexpected charge is one you actually owe, Wang suggests trying to negotiate with your provider.
They may offer you a payment plan, or if you agree to pay in cash right away, they may discount the amount.
Well, if possible, know exactly what's covered before you go in for a procedure. That can help avoid surprises later. Also, if you're asked to sign a document that says you accept financial responsibility, write in that you only agree for services that are in network. It may help you if you need to dispute a charge later, so you don't waste your money. I'm Glenda Lewis. Back to you guys.
Some good advice, Glenda. Thank you.